Dear students, I hope that I could be heard clearly. Glad to deliver today's lecture dedicated to occupational diseases, the subject of occupational diseases, and the more specific topic, occupational diseases caused by physical agents. It is supposed that this lecture has to be delivered for the students of medical faculty or general medicine with aiming on upgrading their knowledge at the 5th year in field of occupational diseases in general, and more specifically related to their future specialties. So, first of all, occupational diseases caused by physical agents is the heterogenic group of diseases, including a set of them. Let's discuss them one by one and then focus on the main of them. First of all, vibration disease. The causative agent is vibration, and we may widely meet this factor in different industries like mining, metallurgic, foundry, roadworking, tunneling, and many others. And I must say that from formal point of view, vibration disease seems to be one of the two specifically or absolutely specific occupational diseases. The next representative of possible changes, occupational pathologies caused by physical agents, is occupational cochlear neuritis. It is caused by excess noise at the working place and results in both specific changes, specific symptoms like deafness, loss of hearing or decreasing of its parameters, and non-specific with neurotization of the person, with psychopathization and many others. So neurotropic influence, non-specific. A part of this, we have such a nosologic form as occupational decompression disease in those who dive deeply and undergo often and prolonged or repetitive decompression while going up from the deep water. Then we have occupational altitude disease, for example, in pilots of especially reactive airplanes, of cosmonauts, or climbers on high altitudes. They suffer from the lack of oxygen in surrounding air, and therefore disturbance in the organism. Occupational disease caused by electromagnetic fields is extremely heterogenic because electromagnetic influence or field starts from ionizing radiation, and there could be radiation sickness, etc., up to visual diapason or maybe ultraviolet diapason before visual, right? And they could be burns or something like that. There could be visual diapason, and there could be over lighting, excess light influencing on eyes, etc., or infrared and with overheating, etc., or they could be with irradiation with high energy caused by laser or in form of laser, and this may cut off some pieces even of the human body, etc. Occupational disease caused by ultra and infrasound, same in this diapason from infrasound below 20 hertz, which results in mostly psychogenic influence with neurotization, psychopathization, with feeling of fear and many other things. And ultrasound, vice versa, exceeding 20 kilohertz in frequency. This may result in case of contact influence in so-called angioneurosis, disturbance of regulation of vascular tone. Occupational overheating and overcooling, two opposite conditions, right? They could be also both general overheating or local burns, thermal burns. And same for overcooling. It could be general overcooling of the whole organism of the body and local or focal frostbites. In inappropriate conditions, mostly related to peculiarities of microclimate of the person in place of work. For example, overheating is often met in foundry departments, in metallurgy, in those places where it's too hot, or it could be at outer space in, for example, agricultural at hot period of hot season, I mean. Or vice versa, overcooling might be both winter season or cold season, and in those fridges, right, industrial fridges where some person has to work for some time. One of the last groups of occupational disease caused by physical agents is mediated, not caused, but mediated by increased or decreased humidity. It's closely connected with overheating and overcooling, but it's slightly different because a part of modeling, right? Modeling of temperature, the high or decreased humidity may also result in direct influence on the body in form of dermal changes and etc. But today we are going to focus on one, or if we if we manage even two occupational diseases. And one of them is vibration disease. Let's go inside. By definition, vibration disease is the absolutely specific occupational disease caused by enough prolonged, yet goes to enough exposure to vibration, its causative agent, and characterized by heterogenic polymorphous clinical manifestations, but with obligatory affection at least two or maximally three, optionally three, not maximum, optionally three systems. First, nervous system. Second, microcirculation. These are two obligatory. And the third one, affection of locomotor system, is optional. In some cases, it is present, in some absent, in some more expressed or less expressed. There is a plenty of synonyms used for vibration disease in literature. I'd like to, oh my God, one moment, let me correct. For instance, one moment. There is a misprint for abnormal formatization, vibration secondary Raynaud phenomenon, right? Here is the correct name of this condition. Start. Oh my God, it continues. One moment, let me go inside. And here we are. Vibration disease, yeah? Oh my God, one moment. Let me find it. Sorry for this technical. Yeah, it should work now, right? Should it? I hope it should. Let me check. Yeah, it works. So vibration disease is the mainly used term for this condition. But in some American textbooks, this condition might be named hand-arm vibration syndrome, or in abbreviation HAVS. In Britain, textbooks or manuals or guidelines, etc., sometimes they use vibration or secondary Raynaud phenomenon. and not so widely used nowadays, but maybe you might find such terms are syndrome of so-called dead fingers, vibration white finger, vibration-induced vasospastic disease, or even more ancient descriptive names of this condition like Grinder's cramp or spastic anemia. Again, the correct term is vibration disease. The etiology of vibration disease is literally vibration. All the rest possible factors are precipitating, they are modeling the vibration, they may predispose or protect the influence of vibration, but cannot cause vibration disease by themselves. But vibration is the only one. As maybe you remember, there was such a slide in that your general lecture and practical class dedicated to general aspects of occupational diseases, 5 main pathophysiological aspects of vibration of occupational disease, and one of them was monoetiology of each disease. Take care about this. Next, there are following possible parameters of vibration disease which might be useful for our operation. Vibration frequency. The perceptible diapason is from 25 Hz up to 8 kilohertz. Vibration amplitude in millimeters, vibration wavelengths also measured mostly in millimeters, vibration velocity and acceleration. As you can see on this slide, in order to simplify for clinicians the evaluation of vibration, velocity and acceleration were combined in form of vibration intensity, right? And measured in decibels. It's much more understandable. I'm sorry for interrupting the lecture. I wonder why some students switching off while not registered for the lecture. So I'm sorry to inform you that if you haven't registered, you will be stated not by me, but also by the system as missing the lecture. So please take care about this. Let me check. Just a few seconds. Let me see if you have registered or not. In the invitation, let me show probably on the screen now. In the invitation, you have the link to registration form. Do you see on the screen now? Here is the place where you may follow. I copy paste this link to your chat for your convenience. And if you have registered, that's okay. If not, so no one would know whether you attended this lecture at all. So you will have to work off it. Let me check just a few seconds. Oops. Let me see the one moment. Okay. And where is the lecture? Here it is. Let me see whether you have registered or not. Yeah, one of you have registered, only one. The rest not. So take care about this. Good. And let's continue the lecture by itself. So again, returning to the matter of our lecture, the main characteristic or parameter which I'd like you to remember, in which you may clinically significantly measure the vibration, is vibration intensity measured in decibels. By other approaches to classification, vibration disease may be also classified, right, by predominant application, by location, right, local, general, or combined, or by source, transport, technological, or technological, by frequency diapasons, I mean, not absolute value of frequency, but some groups, right, or diapasons, low frequency, middle frequency, and high frequency. By time regimen, constant or periodical. By direction, by z-axis, it's vertical, yeah, perpendicular to footprint. By x-axis, horizontal from back to breast, and horizontal from right to left shoulder, right? Y-axis, you may see. I'd like to wonder your opinion, what kind of direction is more dangerous? Again, vertical, transversal horizontal, or sagittal horizontal? Please type your answer in the chat to let me know your opinion, and later I will comment. For instance, among these classification approaches, from my point of view, from my experience, most useful for clinician are by predominant application, local or general, right? Because they have different, significantly different clinical manifestations. And from point of view of evaluation of the case, again, clinical, by time regimen, constant and periodical, by frequency diapason. The higher is the frequency, the more likely there will be changes in vascular condition, and the lower is the frequency, more significant will be damage of locomotor system and tissues in general. And by direction, thanks for your answers. If you've done any about direction, the most dangerous for human being is vertical orientation of general vibration. Okay, so in terms of main kind of disorders, neurological changes in case of vibrational disease are present always. While the second obligatory one is affection of vascular sphere or vessels, and optional is orthopedic disorders. But you should also take in mind that in high frequencies, affection of cardiovascular system and small vessels more specifically is more expressed, while in low frequency and therefore higher amplitude, changes of locomotor system will be more expressed. In order to understand this, it's easy to realize, there is a reason to realize the amplitude. The higher is the frequency, the lower is the amplitude. Not so big root and damage, I mean deformation of tissues takes place in these workers, and therefore not so express affection of tissues and remodeling of them develops, while the quantity of these deformations per some period of time is greatly higher, and it leads to more significant affection of neural structures, vegetative component of neural structures, and therefore vascular reaction. I'll explain you on the next slide these interrelationships between these aspects. While precipitating agents for vibration are overcooling, in overcooling there is typically vasospasm and decrease of trophic maybe function of vascular net, and there is also might be disturbance, even some kind of frostbites, yeah, or general or cooling, and this leads to more early and more significant, I mean, more expressed damage and clinical manifestations of vibration disease. Microtraumatization. Every person who works manually so much or undergoing some physical work or has to do some physical work undergoes more or less expressed micro, at least, but traumatization. And again, these repetitive traumas of certain locations precipitate, they make these tissues to be inclined to remodeling, to change, to fibrosis, to deformation, etc. Physical overloads, in turn, are also similar to microtraumatization. For one hand, physiological uh, work or activity is good for such persons because they improve circulation, they improve neural trophics. While if it is exceeding maximal permissible levels, it may cause disturbances, of course. Okay, one moment. Then, a set of changes in which influence of vibration and precipitating agents result. They include a set of neurological disorders. They start from sensory changes, decrease of perceiving, yeah, sensation. Then, on the background of sensory changes, vegetative components appear and progress. And then, on the background again of sensory and vegetative changes, motor disturbances appear and progress in form of palsy, paralysis, etc. Microcirculation disorders may be manifested in form of angiodystony, angiospasm, and angioatony. One moment. Okay, I will correct later. There is a misprint again. So angiodystony, this disturbance, right, of vascular tone. This means that they could be both sides disturbances, both enlargements, yeah, of the vessels and the spasm, and they may be abnormal and even how is named like paradoxal, yeah, paradoxal reactions when some person is stayed in hot surrounding hot environments but develops angiospasm. Later, after some progression, there is domination of angiospastic condition with not so much dilation. And when there is ex host of regulation mechanisms, there could be even atonic condition of vessels with accumulation of blood in them, with cyanosis, with hypoxemia and hypoxia development. And this is the most severe condition in terms of microcirculation disorders, typical for advanced stages of vibration disease. Disorders of rheological properties of blood. There is a plenty of these changes. In brief, if I would explain to you, to just make you remember, these patients, due to disturbances of neural vegetative regulation of vascular tone and this dystony, angiospasm, and even angioatony, they develop edematous condition. So what is named transfusional. It's going of fluids from blood into tissues and accumulation there, and the rheological condition of blood significantly undergoes changes in form of increased viscosity, etc. And this in turn predisposes to formation of disturbances of blood flow, right? There could be even thrombosis with possible significant and fatal even disturbances of circulation and necrotization of peripheral tissues. Disorders in oxygen exchange by itself on the level of the red blood cells and hemoglobin, even on molecular level. All these changes are mediated by oxidative stress, by disturbance of the vascular wall itself with endothelial dysfunction, by inclination of persons with vibration disease to tonic condition of vessels and therefore systemic arterial hypertension, predisposition to atherosclerosis, etc. Right? Disorders of hypothalamic pituitary adrenal system, they are not so expressed as they could be in case of typical classic endocrine disorders. But anyway, all these changes, systemic changes in the organism, are mediated by these components. They could be inclination to, for example, stress related, because vibration is stress, right? Stress related hyperproduction of pituitary hormones and therefore hyperfunction of thyroid glands, for example, and adrenal glands as well. And this leads it, all this puts the person, it's his organism into a stressful condition, right? With primarily domination of sympathetic components of autonomic nervous system, and then exhaust and transformation into domination of parasympathetic or the modulating, right? Good. Overexcitation of peripheral vegetative formations. It happens already at the very beginning of the changes. Primarily, this overexcitation might be non-specific at all, not so expressed, while at the highest level of its development, there could be even attack of acroangiospasm. Acros means hands, or even arms. Angio, vessel, spasm, spastic condition. So spastic condition of peripheral vessels on the arms mostly, but on the lower extremities as well, on the limbs. And this condition is, so it requires emergent medical aid. Damage and remodeling of locomotor system. I have partly explained already the mechanism of high amplitude vibration influence on any tissue, including bones, joints, ligaments, cartilages, tendons, muscles, anything. And due to this remodeling, maybe not due, but this remodeling itself is compensatory. It is adaptive until it results in pathologic, so expressed remodeling that this leads to dysfunction in this person. I'll show you on the later slides what exactly happens. Ordinary, I try to draw something on this. Let me think whether I will draw it now. One moment. Okay, I will not now, but I will explain. Well, maybe let me think. How can I do it now? Just one moment. There should be some like this. One moment. I'll make a screenshot and draw this for you. One moment, and more and more. Okay, so let me choose and copy paste. Good. One moment. Okay. Okay, and okay. Okay. Like, I hope you see the screen clearly now. And let me explain what I mean. A few words about pathophysiology, yeah, pathogenesis of the vibration disease. So primarily, what do we have? We have, let me think what exactly, let it be, we have, oh yeah, we have different pens here, all right, let me see, oh yeah, they could be different colors, great, super. So let it be, for example, that bluish. So primarily, what do we have? Let's imagine that some person undergoes influence of local vibration. So he keeps some handheld instrument, right? Under the influence of this vibration, at the very beginning, at the very early, not even stages of vibration disease, but mostly early phases of adaptation of organism to influence of vibration, and maybe you even have your own similar experience. When you keep something vibrating at the very beginning, you feel it well enough, but in few minutes or some 20 minutes, 15 minutes, etc., this vibrating instrument becomes not to bother you so much, right? So you do not perceive it so much because of decrease of perceiving of it on the physiological level, on the nervous system. So let us imagine that here, oops, maybe a smaller one. Here there is gradual decrease of sensation, right? And if this lasts for 1 day or maximally 2 days, right? With improvement after the weekends, especially, this is just a variant of norm. But if it lasts for more prolonged time than 2 to 3 days or maximally 7 days, this is a sign of already developing hypersensitive changes or hyposensation or hypostasia. Hypostasia. This is connected with both affection of peripheral parts on the level of receptors, decrease of sensation, right? Decrease, even trophic disorders of them, and conduction of sensory nervous impulse to central representative, and disturbance of sensation in the brain, in central parts of the analyzer, right? As a result, so at this phase, it's the best chance for us to detect this decrease of sensation and to exclude this person from the influence of vibration. And in this case, he will not suffer from it at all. He will recover fully and may even continue working in same conditions, maybe with some restrictions. But unfortunately, very rarely when doctors detect these changes on the stage or phase of sensory disorders. Unfortunately, it progresses rather often towards, let it be this one color, to vegetative component because of both direct influence on the vegetative structures and indirectly due to overexcitation in central parts and affection of vegetative centers, and therefore disturbance of neural vegetative or autonomic, there are synonyms, regulation of vegetative reactions on periphery, right? Uh, One of vegetative reactions is regulation of vascular tone. And if normally after this stressful influence of vibration on the surface, some person recovers at night when, for example, at daytime there is domination of sympathetic nervous system, at night parasympathetic, and during the night period there should be enough time and all resources to recover. But if this doesn't happen, the full recovery, these changes accumulate more and more and become stable even after vacancy period in a week or 2 or 3 or even 1 month. This person remain to show, to demonstrate, to manifestate these symptoms of both sensory disorders and vegetative component. It may be manifested like increased cooling at even not so low temperatures, as a feeling of numbness, dizzying, or something like that. You see, uncertain feelings, not so specific. No, some attacks of acroangiosperm or so. It could be uh, pallid or cyanotic or mm, some discoloration of skin on peripheral parts of the body, especially hands, right? In case of local influence of vibration, so that these people do not realize that they're actually ill. And it's a duty of medics to educate them how to recognize this early stage and refer to doctor in time. At this stage, when there is not only sensory disorders, but also vegetative changes appear, this is a rather severe condition, so it will not recover fully and quickly. It may recover in years, in several years, under the action of our some additional care, yeah, medical care, some treatments. But prognosis is very good. In general, prognosis in vibration disease on this stage is good enough, right? But some people do not stop on it and continue to work. And in this case, what exactly happens? There is development of not only vegetative and sensory, but also motor changes. What's the mechanism of motor changes development? For one hand, there is a problem with what? With constant and prolonged irritation through the sensory part of nervous system, overexcitation of central um, parts of analyzers and the irradiation into motor zones, etc. Then vegetative components conditions the development and progression of trophic disorders of organs effectors, yeah, effector organs. I mean muscles mostly and the rest. And on some level, there could be even affection of locomotor system itself, predicting further development of neural components, because those people who have to carry this heavy vibrating instrument for prolonged time, repetitively, from day to day, from week to week, from month to month, from year to year, their muscles and all the locomotor system undergoes over straining, significant overstraining and trophic disorders and remodeling and maybe even microtraumatization and fibrosis developed inside and etc. And these neuromuscular apparatus, right? These mechanisms also suffer from this, and this leads to primarily decrease of stamina, the ability of nervous system to contract muscles for prolonged time. Stamina is decreased. The maximum power remains normal for prolonged time, but stamina is decreased. And only then, after progression, at the very severe cases, extremely severe, there could be affection with the decrease of maximum power as well, yeah, maximum strength. And very often complaints these people represent is so that they say, doctor, I can get some heavy weights, I can lift it well enough, but I cannot carry even small weights for prolonged time. Just hands cannot contract so much for this time, and this weight gets dropped. A part of these neurologic changes at the phase of vegetative disorders, these people start to represent vascular changes, right? This dysregulation of vascular tone and attacks of acroangiosperm, mostly triggered by mostly maybe overcooling, then sometimes physical stress, yeah, after physical work at night, etc., and even mental stress. Sometimes spontaneously, but associated with mental stress, there could be attack of acroangiosperm. And of course, as it was several times already mentioned today, in people with um, vibration disease, rather often we observe, especially in case of influence of high amplitude or low frequency vibration, the affection of locomotor system in form of almost everything that you may imagine in this relation, like osteoarthritis, osteoporosis, arthrosis, ligamentitis, ligamentosis, tendinitis, myofibrosis, myositis, etc. You see? So many things may happen. So let's continue with the rest of our material for the lecture. Industries in which there is a relatively higher risk of development of vibration disease. These industries include metalworking, machine building, especially foundry departments of machine building industry, metallurgical, of course, construction and the production of building materials, right? Mineral resource, and agriculture, transport, road workers, tunnel workers, etc. Here are the examples of typical professions or occupations with high frequency, low frequency, local and general vibrations. You may see that high frequency local vibration is associated with use of emery machine, high speed drills. This is important because low speed drills is example of low frequency. Then cutting machines, right? Some other similar uh, equipment. Low frequency local vibration is typical in grass choppers, in when processing some trees, right? Road workers, one more road worker, and even one more, and general vibration. Oh, it's also local, but low frequency in mines, right? Mining something, and low frequency, pardon, it's not local, but general, right? General, oops. General vibration is hmm, typical for example, drivers of heavy machines, in concrete workers, etc. Let me see. Oops, maybe this one. Yeah, in the pilots of helicopters, right? In drivers of these tractors, in concrete workers with trembling stand, you may see. So the most widely used classification of vibration disease is based on the location or place of application of vibration, such as vibration disease caused, not vibrational, but vibration disease caused by local vibration, vibration disease caused by general vibration, and vibration disease caused by mixed vibration or combined. The main syndromes which develop in any kind of vibration disease include the following main syndromes: angiodystonic and angiospastic. If you remember, I have already explained the difference. Angiodystony may be related to both spastic and dilative changes of the vascular tone of vessels. And angiospastic is mostly inclination to spastic condition. Then polyneuropathia or polyneuritis, sensory vegetative and motor, but usually develops just like layers of the each one. So primarily sensory, then on above sensory there is also vegetative, then sensory, vegetative, and motor, not vice versa. Encephalopathy. Encephalopathy is not a disease itself, it's like really a syndrome. It may be manifested by different clinical masks. The most often I met is probably hypertensive attacks, right? Hypertensive syndrome, cardialgic, then diencephalic syndrome, and it in turn may have different manifestations. Then epileptiformic, yeah, epileptiform changes, something like that. Then, as we have already mentioned with you, changes from side of locomotor system, vegetomyofasciitis, myositis, myofibrosis, osteoarthrosis, arthritis, osteochondrosis, etc., myositis, we have mentioned. Then, and vestibular, I forgot to mention previously, if the vibration is influencing on the whole body, or at least on the feet in standing position of the worker, this may primarily, just already at the very beginning of the pathologic process, influence on vestibular apparatus and development of vestibular syndrome with dizziness and everything typical for it. Good. Let me show you some examples of acroangiosperm. You may see how whitish become the distal phalanx of the fingers. They also are what a there is a hyperhydration, yeah, sweating, and they become cooled. Sometimes, very rarely, this whitening occupies not only distal phalanx but also middle all over the whole finger. Here is the difference, for instance, on the hand with acrospasm and without. Probably this photo was made from patients undergoing a special functional test. We name it cooling test. When we ask patient to put one of his hands into cooling cold water, the other remains intact, and then we compare the condition on each of these two hands. I'll show you just a few slides later. And one more illustration. Good. And now let us discuss the different kinds of vibration disease depending on their severity. We'll discuss mainly by vibration disease caused by local vibration and vibration disease caused by general vibration, because vibration disease caused by mixed or combined vibration will be just like overlap, yeah, of these two kinds. So vibration is caused by local vibration at the very first degree is characterized by two components obligatory: peripheral angiodystonic syndrome with rare acrospasms and sensory or vegetosensory polyneuropathy of upper extremities. How do we understand that this is rare or not rare or often acrospasms? There is no strict differences stated, but in average, from my experience at least, if the attacks of acrospasms appear at least maybe one, maybe two times per week, we would state it as often already, yeah? So if one time per week, it depends on duration of them, whether each week or not each, so it depends. While it's like some marginal, yeah, condition. And rare is if not every week, not even every month, there is an attack of acroangiosperm. This is rare. This is the first degree. And second component, sensory or vegetosensory polyneuropathy. Again, in the majority of cases, unfortunately, we detect the vibration disease at this first degree with already combination of sensory and vegetative changes. But let me remind you that the best way, the best practice is to detect much earlier at the phase of only a long-standing sensory changes without vegetative. Complaints include transient paresthesia, numbness, tingling, creepiness, etc. With episodes of dull pain in distal parts of hands, especially on distal phalanx, chilliness of fingers, then episodes of rare episodes of wetting of fingers on cooling, or as we have mentioned with you, we have discussed on physical exertion and mental stress. They also may precipitate the development of this acrospasm. And on physical examination, you might observe cyanotic or so-called mottled skin. By mottled skin, I understand that there are like spots of normal color of skin and cyanotic, and even sometimes such a hyper how these names red, yeah, color of skin, just small spots, yeah, like a spotted, yeah, skin. Hyperhidrosis or vice versa dryness of hands. Again, hyperhidrosis in phase when there is such a undulation, right? Where there is balancing between sympathetic and parasympathetic components of vegetative hyperactivation. And then it turns into dryness because of ex-host of vegetative regulation. Then there could be hyperstasia and then transforming into hypostasia to vibration. The phase of uh, the phase of hyperesthesia, it takes place at the very beginning, as we have mentioned with you, even in normal persons, almost healthy. And while progressing, it turns to hypostasia, primarily as a compensatory mechanism, and then it becomes more constant, permanent, and pathologic. Hyperkeratosis develops, for one hand, due to local friction of some components of these instruments and direct defense of the tissues to this friction, to this influence. For other hand, this hyperkeratosis is moderated by or precipitated by trophic disorders of vegetative nervous system disproportion, yeah, disbalance. At the second degree of vibration disease caused by local vibration, let me show you. There is a phase of so-called moderate changes, yeah, moderate manifestations. Range. The same two main syndromes remain. I mean, in terms of peripheral angiodystonia and of upper extremities, but here we have often acrospasm. Vegetative sensory polyneuropathy of upper extremities is often components of this condition, and it manifests with often angioacrospasm of fingers, with stable vegetative trophic disorders of hands, with dystrophic disorders of all tissues and especially locomotor system, cervicobrachial plexopathy, and cerebral angiodystonic syndrome. The fact is that with experience, when I enter the ward with different patients inside, I start to even recognize what kind of, possibly, most probably, what kind of work each of them have been performing, because those who underwent influence again of high amplitude, low frequency vibration, they develop significant deformations of joints, fingers, etc., and vice versa. Those who have been working as polishers, emery machine operators with high frequency vibration, they mostly develop vascular disorders with this cyanotic or motile skin and something like that. Let me see. Just one moment. Mhm. Okay. Hope you hear me, because I'm not sure. Let me check if I'm still online. Mhm. Mhm. Good. Seems so that I'm still online. Let's continue. Okay. What else? Plexopathy. About plexopathy, when you perform the physical examination of such a person and ask them, just check for the diapason of movements, etc., they have painful limitation of the diapason of their movements at upper regions. So they simply cannot raise their hands without pain in this cervical or cervicobrachial region. It has different mechanisms. For one hand, there is disturbance of motor function itself. For other, uh, in these tests, when you perform them, there is a tension and of these nervous structures of nervous plexus, cervicobrachial plexus, and if it is inflamed, if it is provoked in this relation, this tension. So if normally it would be easily elastic, right, and maybe become more plastic. In case of this condition of second degree of local vibration disease caused by local vibration, it becomes painful for this extension, right? And you may easily reveal this by physical examination even, and of course, the help of additional investigation is significant here. Okay. Then the most severe degree, advanced degree of vibration disease caused by local vibration is characterized by even more remarkable manifestations of all what we have mentioned. If there was mostly affection of peripheral regions of upper extremities, now there is possible development of encephalopathy. And not only sensor and vegetative, but also motor components of these disturbances. Then, regarding vascular components, if they was mostly angiodystonic with rare angiospasms and mostly from side of upper extremities at third degree of vibration disease, uh, these attacks become generalized from side of both upper and lower extremities as well. And with even cerebral disturbance of circulation, sometimes this condition may be characterized as transient ischemic attack, yeah, and even stroke sometimes. Then a few words about vibration disease caused by general vibration. In this condition, there is slightly different situation, but similar to what we have discussed about vibrations is caused by local vibration. At the very first degree, we have angiodystonic syndrome with rare occurrence spasms, but already of lower extremities, from side of lower extremities, and possibly cerebral. And if you remember, the vibration is caused by local vibration, we had mostly or only from side of upper extremities. Then here we have vegetative vestibular syndrome already the first degree, and the vibration is caused by local vibration. It is not typical at all. And sensory or vegetative sensory polyneuritis for one hand, it happens from side of lower extremities. For other, it may be more expressed than in case of local vibration because it covers, it influences on the whole body. And by this, you may reveal this condition earlier than in case of local vibration. Vibration disease caused by general vibration at second degree of so-called moderate manifestations is characterized by cerebral and peripheral angiodystonic or even angiospastic syndrome. Second, syndrome of sensory and vegetative sensory polyneuropathy, and similar what we had for local vibration. There was syndrome of cervicobrachial plexopathy. Here we have polyradiculopathy. We had, or even secondary lumbosacral plexus syndrome. And in general, there are functional disorders of multiple functional disorders of nervous system. And the very advanced third degree of vibration is caused by general vibration. We have, again, maximally expressed changes, sensory motor polyneuropathy of lower extremities and systemic syndrome of encephalopathy, development of it, and syndrome of angiopathy with generalized acroangiospasms. And I must say that both in regarding vibration disease caused by local vibration and general vibration, frankly, I have never met patients with these conditions. Why? Because at least in my country, in Ukraine, the system of healthcare in general, even with some not so advanced, but anyway, it is enough by quality to reveal this patient at first or second degrees. And after elimination, after stoppage of work of these workers under the influence of vibration, they start to slightly recover, fully or not so enough, but anyway, there is good prognosis for them. The earlier, of course, we detect, diagnose the vibration disease, the better is prognosis, while in any case, we have chance. In order to primarily diagnose, let me see. I will add one more examination test. Let me think how it is named. It's electroneuromyography. Electroneuromyography. EMG. Yeah, EMG. Or ENMG, no, mostly EMG is well-known abbreviation. So a part of general physical examination before it, asking questions to the patient regarding his or her complaints and history and everything. The essential are special additional investigations, mostly instrumental. They include nail fold capillaroscopy, thermometry and thermography, cooling test, hand aesthesiometry or palesthesiometry, dynamometry, and electroneuromyography. And optionally, there could be other tests, but they are not so widely used. Let's discuss them one by one. Let me explain them. So here is the outlook of the microscope, specially intended for capillaroscopy. As you can see, it's usual biological or medical binocular microscope, even stereo microscope, with in case of if there is a need to document the changes, there is a third ocular for the camera in this microscope. And here is, for instance, the photo of our real investigation with our students of our research society at the department of real patients. And here is the outlook of the capillaroscopic picture. Normally, we have, there is a plenty, as you can see, let me show you, there is such a form to detect and document different parameters of the capillaroscopic picture, including 10 of them, right? I'd like to highlight maybe 3 for you, even 2, but 3 would be enough, definitely. It's the color of background, it's the quantity of capillaries per square millimeters, and the condition, the state of capillaries. It would be enough. So if we return to the illustrations, let me see. At normal person, the background is pinkish, right? The quantity of capillaries per square millimeter varies from about 10 to 12 capillaries per square millimeter. And the condition of capillaries is normal, slightly thinner arterial or arteriolar parts of the capillary and slightly wider venous or venular parts of the capillary. Then there is, in case of first degree of vibration disease, the condition of vessels, capillaries, becomes, as you can see, more inclined to this spastic condition. They are spastic and dilated. There are both spastic capillaries here, branches, and dilated. While in second degree, the background becomes less pinkish, but more pallid, and the quantity of capillaries per square millimeter becomes lower when comparing with normal person. And in second degree, the background becomes extremely pale. The quantity of capillaries is extremely decreasing, and you may see that there are dilated branches of the capillaries with stasis of blood inside them. I don't have illustration of the third degree of this condition because, as I already introduced, I've never met such patients at all. So it is described, of course, in some other countries they might be, but I've never met. So again, in the register, the minimum we should detect regarding the capillaroscopy is the color of background, the quantity of capillaries per square millimeter, and the condition of the, here it is, of the capillaries themselves. The other approach to detect possible changes in hands of the person with vibration disease, not only hands, for instance, it is illustrated mostly on hands, but this may be from side of lower extremities as well, from feet, is thermometry itself or thermography and functional test with cooling. We name it simply cooling test. The methodics of this investigation is so that we ask patient, it's really real our patient with our students, we go there and ask patient to put one of his hands into cooling water and then compare the condition, the temperature, superficial temperature before cooling of that hand and symmetric and other. Same for feet, for instance. And there are different variations of these cooling tests. In our clinics, we use mostly 1 minute test, right? When we measure the initial temperature, then ask patient to put his hand into cold water. The temperature of this water is about 10 degrees by Celsius for 1 minute, and then getting back and comparing the temperature before and after on same hand cooled before cooling and after cooling, and symmetricity about the other hand. Normally, the difference might be significant even, right? But there should be full restoration of the temperature in about 20 minutes. We detect this temperature each 5 minutes till half an hour, 30 minutes, and then just state whether the full restoration happened or not, or on what minute the full restoration has happened. If there is no full restoration, if there is this significant difference in temperature of cooled and not cooled hand, we make decision that there are some problems with circulation probably, and there could be different reasons. This might be due to disturbance of rheology of blood, the quantity of blood, the condition of tissues, the even quantity of vessels and their condition as well, including regulation, vegetative regulation of vascular tone. So this is one of indirect ways to detect angiodystonic, angiospastic, and other symptoms, but indirectly again, or syndromes. The next, and very significant as well, investigation is palesteziometry. It's a measuring of hand palmar sensitivity. We detect, I'll show you now, wide zoom in the photo. Here is one also our real patient with our students, and we perform evaluation of his perceiving the vibration on that whitish vibrostand, right? He simply touches by his fingers this vibrostand, and different, I'll show you now, different intensity and frequencies of vibration are applied to this vibrostand. Differently or distantly for each of hands. So how is it performed? We ask patient to put his hand, we turn on the equipment and apply some vibration or not apply. And we may ask him whether he feels or not. For example, he says, yes, I feel. So we turn on 63 hertz. We increase the intensity of vibration. It was at 5, then at 10, for example. He says, yeah, so at 5, for example, he didn't feel. At 10, he started to feel. In this case, we make conclusion that the threshold, the margin of this feeling is 10 decibels. We turn to other frequency, 125, and minimal intensity. Do you feel? No, I don't feel. 5 decibels. Do you feel? No, I don't. 10 decibels. Do you feel? No, I don't. 15 decibels. Yeah, I feel. The threshold is detected. And same for other hands and on different frequencies. In our clinic, we use 63, 125, and 250 hertz. But in other, they could be different. It depends again. The other one, investigation, which is required rather often, is dynamometry. As you can see, it's not usual, it's not ordinary maximal dynamometer. We measure the, I would name it interactive, by interactive dynamometry. What's the methodic is? We ask patient to contract his hand as with maximum power as much as he can, and detect this maximum. Let me see. Let me show you the maximal strength, right? On right and left hands. And then ask him to contract up to half of maximal strength and keep as much as possible, as long as possible. It's enough for us if he keeps it contracted for 45 seconds because it's norm. But unfortunately, in the majority of cases of initial um, or expressed motor disturbances, these patients fail to contract half of maximal strength or power for this duration. They release their hand just in a few seconds, 1 or 2, or no, not one maybe, but for 5, 10 seconds or 20. Anyway, it's too few. And you may take in mind that some of these patients are so powerful that they may have maximal strength of 100, 110, 120 kilograms, but they cannot afford half of it for such a short period. While uh, some of our students, especially girls, may have maximum strength of 40 kilograms or even 30 or even 20, but they easily keep half of it for prolonged time. So this investigation is useful. A part of this we have, as I mentioned in the list, electroneuromyography, right? Electroneuromyography. It's objective examination, which instrumental examination, functional one, which let us detect objectively even the level on which there is a problem with generation or transduction of the nervous impulse or contraction of muscles. So we may locate the locus morbi, right? Be sure where there is the most significant changes and act with our treatment more smartly, yeah, more become more smart in our attempts. The question is, and I'd like you to write your answer in the chat, whether these tests we have mentioned with you, we have discussed, are specific for vibration disease or just typical or non-specific at all. And I continue while you're answering, I continue with the presentation to differential diagnosis. This condition, any kind, for instance, of vibration disease, both caused by local vibration or general, should be differentiated from at least what is stated here on the slides, but maybe I will add some. Raynaud syndrome, Raynaud even syndrome or disease. We distinguish Raynaud syndrome and Raynaud disease. Disease is constitutional, right? And syndrome might be constitutional or might be acquired. Then syringomyelia, it's when there is disturbance of sensation. So about Raynaud syndrome, when there is a long-standing Raynaud syndrome, these patients represent mostly or alone only disturbances of circulation, right? While there will be no affection of so significant affection of sensory and vegetative components of nervous system and locomotor system, etc. In syringomyelia, there is vice versa. There is decrease of sensory component, but with normal condition of the circulation. And there is one more important difference with syringomyelia. In syringomyelia, rather early, there is decrease of temperature sensitivity, right? All kinds of sensitivity, including temperature. While in case of vibration disease, there is mostly decrease of tactile vibration sensitivity with almost normal temperature sensitivity and even pain sensitivity. And of course, for syringomyelia, the vascular and locomotor system changes are not typical. Vegetative polyneuritis, it's very similar to what we have in case of vibration disease, but vegetative polyneuritis is usually it's one-sided, right? Polyneuritis, but one-sided usually. Even if it occupies both of extremities, usually it is not accompanied by neither vascular significant changes, right, nor by especially locomotor system changes. Myositis, no vascular, no neural changes, mostly inflammation of muscles. Then the diabetic polyneuropathy, diabetic polyneuropathy, Then alcoholic, right? In alcoholism. Alcoholic polyneuropathy, etc. Other conditions accompanied by similar but not same changes as we have in vibration disease. Treatment. The treatment of vibration disease is non-specific at all. It's mostly related to reasonable employment, to physiotherapy. Again, physiotherapy in terms of some baths and wide variety of electro, ultrasound, what else? Infrared, ultraviolet, electromagnetic, and other media by which they try to improve the trophics, right? In peripheral parts or in neural plexus, etc. Vitamin therapy, especially ascorbic acid and others, neurotropic vitamins. They are mostly related to improvement of condition of nervous system and therefore the rest in vibration disease. Cholinelytics are helpful in case of attack of acroangiosperm. Vasodilators, they might be used both as a routine and in case of attack of angiosperm, and calcium antagonists, they also improve the condition of vessels and may result in better effect from the other measures in combination, of course. The expertise or evaluation of ability to workability is the following. At the first degree, usually we start from temporary for 1 up to 2 months, for 1 month, let it be, employment without contact with vibration. It's like timely, reasonable employment. Usually, how does it happen? This patient, after just the time of when we reveal the vibration disease, he or she undergoes the treatments in some inpatient department, in hospital, then having some resort therapy afterwards for 1 more month. So 2 months came, and if after this we detect the full restoration of everything, we may let him continue to work in same occupation, but obligatory with carrying all the needed hygienic measures. Or if it is impossible, reasonable employment for the rest of time of his life. At second degree, after treatment in hospital and further resort therapy, the reasonable employment is definitely required without any contact with vibration, overcooling, hard physical work, increased humidity, etc. That's all. And at third degree, theoretically, again, I haven't met such patients. These persons develop invalidity, third or second or sometimes even first invalidity group with different capacity to work. Maybe they definitely could not continue working same occupation, of course, in same position, but they could be reasonable employment depending on the peculiarities of each certain person. I must say again that if the vibration disease has been detected in time, if proper treatments has been applied, uh, it is reversible. If not fully, but at least it will not progress. That's good news. So as far as I see, we are going to finish already this first topic of our today's lecture, and the second one will be for your independent study. All the variety of vibration of occupation disease caused by physical agents, with focus on this vibration disease we have discussed and occupational deafness. The prophylaxis is general as in other occupational diseases, technical, like automatization, robotization, then shock absorbing some things, units in trembling these vibrating instruments, etc. Then periodical baths, special gymnastics during the work, periodization, the work itself, and proper preliminary and periodical medical checkups to detect predisposition and already developing changes. Thank you for coming. You have about 4 minutes left for your questions, if you have any. Maybe in this topic or in any other related to occupational diseases, feel free to ask. And immediately one of you has gone. Okay, thank you. So I'll stop the recording.